What is prediabetes, and how can we reverse it? Hi everyone, and welcome to the channel. Today we're going to talk about something that affects millions of people worldwide, but often goes unnoticed until it's too late. We're talking about prediabetes. You might have heard this term before, but what does it really mean, and more importantly, how can we reverse it? In this video, we'll break it all down. So stay tuned. What is prediabetes? So let's start with the basics. Prediabetes means our blood sugar is higher than normal, but not high enough to be called diabetes. It's like a warning sign that our body is having trouble using insulin. Now, you might be wondering, why is this such a big deal? Well, that's because when left untreated, prediabetes can progress, leading to type 2 diabetes. Blood sugar levels. Normal. Prediabetes, diabetes. A normal fasting blood sugar is less than 100 milligrams per deciliter. Prediabetes happens when fasting blood sugar is between 100 and 125 milligrams per deciliter, and anything higher might mean diabetes. It's important to know that one high reading doesn't always mean prediabetes or diabetes. Blood sugar needs to stay high over time for a diagnosis. Doctors also use the A1C test to check your average blood sugar over the last 2 to 3 months. A normal A1C is below 5.7%. Prediabetes is 5.7 to 6.4%, and 6.5% or higher might mean diabetes. Symptoms and risk factors. Now, here's the tricky part. Prediabetes often has no symptoms. We might feel fine, but that doesn't mean everything's okay. That's why it's so important to get our blood sugar checked regularly, especially if we're at higher risk. So, who is at risk for prediabetes? Some key risk factors include being overweight or obese, lack of physical activity, having a family history of diabetes, age. Those of us over 45 are at higher risk. High blood pressure or abnormal cholesterol levels. Previous gestational diabetes during pregnancy. If any of these apply, it's time to pay closer attention to your health. Health risks and complications of prediabetes. Let's talk about the risks of ignoring prediabetes. If we don't take the right steps, prediabetes can progress into type 2 diabetes. But it doesn't stop there. Having persistently elevated blood sugar can lead to serious complications like kidney disease, nerve damage, vision problems, and even heart disease. That's why we need to take action, because reversing prediabetes means protecting your vital organs and reducing our risk of long-term health issues. How to reverse prediabetes. Now let's get to the good part. How to reverse prediabetes. The great news is it's not as hard as we might think, and making some simple lifestyle changes can have a huge impact. Here's a 5-point strategy to reverse prediabetes. 1. Eat a balanced diet. First, let's talk about diet. Eating a balanced, healthy diet is key to controlling blood sugar levels. Focus on whole grains, fruits, and vegetables. Lean proteins like chicken, fish, and beans. Healthy fats like those found in avocado, nuts, and olive oil. And remember to avoid sugary drinks and foods high in refined carbs, such as white bread and pastries. 2. Regular exercise. Next, exercise is super important. The more active we are, the better our body can use insulin. We don't need to run marathons to make a difference. Simple activities like walking, swimming, or cycling for 30 minutes a day can significantly improve our blood sugar control. 3. Getting enough sleep. Don't underestimate the importance of sleep. Poor sleep can affect our body's ability to regulate blood sugar, allowing prediabetes to progress. So, let's aim for at least 7 hours of quality sleep each night. 4. Maintain a healthy weight. If overweight, losing even 5 to 10% of our body weight can improve our insulin sensitivity and reduce the risk of developing type 2 diabetes. We don't need drastic changes. Just consistent, small steps are enough to shed those extra pounds and get on the path of prediabetes reversal. 5. Regular checkups. It's important to have regular checkups with our doctor. Getting our blood sugar tested is the only way to know for sure if we have prediabetes. Doctors recommend getting tested at least once every 3 years if over 45 or if we have any of the risk factors we talked about earlier. Doctors may also recommend other tests, like checking our cholesterol and blood pressure, to assess overall risk for diabetes and heart disease. How to stay motivated. Making lifestyle changes like these can feel overwhelming, but remember, we don't have to do it all at once. Start small. Maybe begin by swapping out sugary snacks for fruit or taking a 10-minute walk after lunch. As we start feeling better, it'll motivate us to keep going. And don't forget to celebrate those little victories. Each step taken brings us closer to a healthier future. So, to recap, prediabetes is a serious condition, but it's also reversible with the right lifestyle changes. Focus on a healthy diet, regular physical activity, weight management, good sleep, and regular checkups. If this video was helpful, be sure to like, subscribe, and hit the notification bell. And leave a comment below. What small change are you going to make today to take control of your health? We'd love to hear from you. Thanks for watching, and see you in the next video.